Hi everybody, welcome to this week's video where I'm going to give a simple overview of different leadership styles in nursing, and I'll give you lots of practical examples as well. So this video should be helpful for anyone on leadership modules, doing assignments, and also for anybody with an interview coming up for a leadership role in nursing, because sometimes you're asked about leadership styles or what style of leadership you prefer. So I hope you find it helpful. If you do, don't forget to give it a thumbs up in YouTube. So looking at the difference between management versus leadership, you might be asked a question in a nursing interview, what's the difference between these two terms? Firstly, management is about keeping things running smoothly. So it's about organising, directing staff and systems. Some examples maybe in nursing might be organising and managing a caseload of patients, or a patient's care where you're delegating care to healthcare support workers and you're managing that situation. As a more experienced nurse, you might manage staff appraisals, or as a nurse educator, organise professional development reviews. As a manager, you might organise the shifts on the ward, manage the e-roster. Excuse me. So management is linked to already established systems and goals, whereas leadership is about creating something new or changing a way of working. So you're working towards a new goal, you're inspiring other people and teams. So it's about having a vision. So for example, changing the way you support student nurses in an area, you might create a new orientation program or a welcome video. You might lead a different way of working on a hospital ward. So for example, changing patients' visiting times across a hospital unit. And it's important to note though that management and leadership are interrelated. So you can't have good leadership without having those managerial skills. So if I was going to lead a project and change the e-rostering so staff would be able to self-roster, for example, I would need those managerial skills to have knowledge of the e-roster system. I'd need to be able to manage the staff requests for different shifts, annual leave, etc. But my leadership skills would come into play because I'd be leading this change. I'd have to talk to staff, communicate, lead the team, and also have adjustments to the e-learning system into this new way of working that I'd envisaged. So if we firstly look historically at leadership approaches and styles, we see that the leadership theory has moved from more earlier view of the leader under trait theory versus this multifaceted dynamic approach to leadership nowadays. And trait theory believes that leaders are born, so they've got these innate leadership characteristics and traits that make them successful leaders. So trait theory emphasizes the core qualities that a leader possesses, such as self-confidence, integrity, being tenacious to drive change through your vision through. Nowadays, though, leadership is viewed more as a dynamic process. It's more about developing relationships, collaborating and promoting practice, positive team working. And it's believed that leadership skills can be developed. And you'll see a lot of nursing leadership programs and postgraduate leadership modules to help nurses develop those leadership skills. Also, you learn leadership through experiential learning, and as a senior nurse you're expected to complete leadership programs, but I would say I probably learned most of my leadership skills from experience, reflecting on my practice when I led something well and then when something didn't go well. So reflecting with your peers is really important. You're never going to get it right all the time as a nurse, so you just got to be able to reflect, complete leadership programs that give you a bit more self-awareness. But I would also say I learned most of my leadership skills from observing good leaders rather than books and experiencing leadership in clinical areas. And I also learned from observing leaders that made poor decisions, or there was poor leadership there, and how not to be a leader. But everyone's got to learn, so it may be that that was just a bad day for them, but it's just through those observations, I would say. So I'm going to start with three of the most classic leadership styles that you'll see first, and I will go through some other leadership styles. So we've got the classic autocratic leadership, and sometimes that's called authoritarian leadership. Secondly, democratic, sometimes that's called participative leadership. And then thirdly, laissez-faire leadership, and sometimes that's called hands-off leadership. So if we start with autocratic, so with autocratic leaders, they will make decisions without collaboration, and this leadership style is a top-down approach. It's effective in urgent situations. So for example, if a patient is about to fall, or a patient may have self-harmed and is bleeding profusely, or it could be during a cardiac arrest. All of these situations, decisions have to be made quickly. There's a lack of time to debate, discuss the situation. You've problem solving quickly. During the COVID pandemic is another example. We saw lots of this type of autocratic leadership in nurse leaders in hospitals. So staff were redeployed and moved quickly to work in other areas. There was beds being moved all over the place. Some wards were shut, some wards were reopened in a different manner. And I mean, there was probably a bit of a mix of leadership styles, as there was some discussions, but some autocratic leadership and decisions were made overnight. For example, we had to create red zones for patients with COVID. So autocratic decisions rely on leaders making the correct decision, and people also need to have trust in the leaders to make the right decision. It's a very effective leadership style during a crisis. Democratic leadership is participative, and it involves open communication, discussion between leaders and staff, and you try to involve everybody in that democratic decision-making process. It is at least staff are given the opportunity to contribute, even though they might not wish to get involved or to give a view. So, for example, we might look at redesigning a patient's day room, or looking at changing rostering systems to move to self-rostering. This type of leadership, you would talk to all the staff, you'd have group meetings, and it's often used for long-term projects where you've got the time to promote staff engagement and collaboration, and where decisions may impact on the team long-term. Moving to laissez-faire leadership, this style, hands-off leadership, sometimes called. Here, leaders give no direction or limited direction, and staff are basically left to get on and do their work. And this works well when you potentially have got a small experienced team. Everybody knows what everybody's responsibility is. There's no need to micromanage. Everyone just gets on and completes the project or the work in hand. But there is research to say that staff, especially in bigger teams with junior staff, do not like laissez-faire leadership style. They see it as absenteeism in their leader. They want the leader to be visible and approachable. They want them to be there. They don't want them to be absent, especially junior staff who need more support initially in a role. I do have another video on my YouTube channel, free, with some helpful research in this area. So it talks about research linked to staff views of laissez-faire leadership, and several of the other references on leadership if you're doing an assignment. And the video is entitled Developing Leadership Skills in Nursing. So do check it out if you're interested in some leadership references for assignments. Also, looking at laissez-faire leaders, they can come across as uncaring because they're not around. In my experience, this type of leadership, especially on ward areas where I've worked many years ago, laissez-faire leadership allows cliques to be formed. So as a leader, you need to be present to monitor what's going on. So if you're not around and just let the staff get on with it, and there's some personality clashes, it can sort of escalate if you're using this laissez-faire style leadership. So following the three classic leadership styles, we've got two relatively new styles of leadership called transactional and transformational leadership styles. And I've seen a lot of job descriptions recently with senior nursing or healthcare professional positions stating the term transformational leadership, or they require a transformational leader. So it's important to know the difference between these terms if you're going for a leadership role. So transactional is more of a top-down approach. It's driven by organisational incentives or rewards, and transformational leadership assumes that staff require structures to complete tasks, these incentives or rewards, and it's used across health and social care employers. It focuses on established routines, and each team member's got specific responsibilities in their job description. They've got the structure, they've got to adhere to local and national standards, legal frameworks, policies. And so an example, a sort of positive example, would be that lots of NHS trusts run staff recognition awards to reward excellence in practice. We've got the Daisy Award, for example. If you don't adhere to correct procedures and policies, though, set out by human resources, there will be a consequence. So an example might be if you let your nursing and midwifery council registration, your professional registration lapse as a registered nurse, you have to be absent from work, employers will not pay you, and as a registered nurse without a PIN, they will usually move to discipline you because you've let your NMC lapse, and that discipline will be on your record for a year usually, and then it comes off. So that's sort of an incentive for you to not let your NMC PIN lapse. Transformational leadership, and this is sometimes called visionary leadership. This is where leaders work together in a team to create and transform a service. So it sort of reflects democratic leadership, that you're developing your relationships, you're collaborating with others, you're talking to others about this visionary vision that you have, but it's about a group of leaders potentially working together in a team to transform this service, and it's about looking to the future. So it's usually used by leaders looking to make big changes, to change the bigger picture across the service. So an example might be that over the last few years, many NHS trusts have transformed wellbeing staff support, and there are lots of local and national signposting on employer websites, and nationally free counselling for nurses when needed, and looking at health and wellbeing. So that sort of reflects the transformational leadership, where leaders work together across all of these institutions to signpost this support. So I've gone through the main types of leadership styles, but we've also got a few others, and you'll see these in different papers probably, especially linked to healthcare. So sometimes you might hear the term collective and inclusive leadership, and this is where leadership is not the sole responsibility of one individual, it's shared responsibility. So it's dynamic process within this group or organisation. It's sort of similar to democratic leadership, but multiple individuals assume the leadership role and they share expertise rather than one leader. Then you've got patient-centred leadership, and this style focuses on the needs of patients to improve their experience and care. It involves patient participation, empowering patients, families and their loved ones. Authentic leadership, here the leader fosters trust through leading with integrity, being honest, open and transparent, so they come across as authentic in their values. We've got collaborative and compassionate leadership, which prioritises a compassionate approach, empathy and understanding of individuals, and understanding where the leader cares for individuals and the team, so they're collaborating together. And Professor Michael West has written extensively about collaborative and compassionate leadership. You might also have heard of servant leadership. So the primary goal of the servant leader is to serve the needs of their followers, which might be staff, patients, rather than their own needs. So you're putting their needs before yours. Building strong relationships and being a good communicator, but empowering others is important under servant leadership style. And then another term you might have heard is situational leadership, and this reflects a pragmatic approach. Situational leaders use a flexible approach and they adapt their style based on specific situations and the needs of their team members and the actual task in hand. So what's your leadership style in nursing? It's helpful to reflect on the different types of leadership styles, and if you're going for a senior position, you might be asked, what type of leader are you, or what type of leadership style do you prefer, or explain transformational leadership. So do you align with one particular leadership style or several? Interestingly, evidence suggests that nurse leaders need to adapt their leadership style because you're working in dynamic, challenging situations. You're having to deal with dynamic, challenging situations every day as a nurse. So you do have to adapt your leadership style sometimes. And so it might be dependent on the context. But there may be one type of leadership style that you think really aligns with you. And I like this quote from Maxwell because it sums up that pragmatic, situational type leadership where it's dependent on context. It sums that up in nursing. And Maxwell 2017, this is from her paper, Good Leadership in Nursing, What's the Most Effective Approach? And it states nurse leadership is in truth a pragmatic blend of theory and evidence adapted to local circumstances, flexible enough to respond to the reactions of the team and agile enough to deal with the unexpected. So it really, you can see that element of the fact that nursing is always dynamically changing. So sort of linking to situational type leadership as well, that we have to be pragmatic in certain local circumstances. So I hope you found this video useful. Do check out my YouTube channel. I've got lots of other free videos, and I have a whole playlist on leadership that covers clinical audit, clinical governance, or lots of key terms that might be used in leadership. My Developing Leadership Skills in Nursing, as I said earlier, has lots of references that might be useful for assignments. And I have a video on NHS leadership interview questions and how to prepare for them as well. So I hope you find those helpful. So good luck with any assignments or any interviews that you've got. And don't forget to give us a thumbs up on YouTube if you found this video helpful.